Hello, everybody, and welcome back. It's Nurse Eunice with Florida Training Academy, and we'll give you about 10 seconds to log on to receive your notifications. And in today's video, we're going to cover the basic vital signs test for CNAs. So go ahead, get pen, paper, and we'll get started shortly. All right, so team number one. What is considered a normal blood pressure for an adult? Is it 80 over 50, 120 over 80, 160 over 100, or 200 over 120? I see a couple of varying answers, but the majority of you said B, and B is the correct response. So 120 over 80 millimeters of mercury, so the mmHg stands for millimeters of mercury, is considered the normal range for an adult blood pressure. And when we break it down, systolic blood pressure, or the top number of the blood pressure reading, is normally 100 up to 140, and the bottom number, or the diastolic reading, can vary. It can be 50 to 80. Some textbooks say 60 to 80, but that is a good rule of thumb for both of those numbers. Great job, team. Let's go to question number 2. Question 2, which vital sign reflects the number of heartbeats per minute? Is it A, respiratory rate, B, blood pressure, C, pulse rate, or D, temperature? I am so proud of you all. Yes, so if you selected C, pulse rate, you have the correct response. So a heart rate is the number of times your heart beats in the span of a minute. A pulse rate is the number of times your arteries create a noticeable pulse due to decrease in blood pressure as a result of the heart contracting. So every time the heart beats, it squishes out, it pushes that blood out at various points throughout the body. You're going to feel a pulsation. And so when we say the pulse rate is how many pulses or how many beats you can actually feel with your fingers. Great job, team. Number 3, what factors can affect an individual's body temperature? Is it the time of day, physical activity, infection, or all of the above? I see C's, I see D's, and I see more D's than I see C's. So great job, team. The correct response is all of the above. For example, right now, even though it's 7:10 p.m. in Florida, it's still about 100 degrees outside. So the time of the day could affect someone's temperature. Physical activity, if I've been running and my heartbeat is increased or my heart rate is increased due to physical activity, I'm going to perspire to try to get rid of some of that excess body heat. But physical activity could also impact someone's temperature. And of course, with an infection, body's trying to fight off that infection, their temperatures may raise as a result. So all 3 of those are the correct response. Therefore, your answer would be D as in dog. Number 4, where is the radial pulse located? Is it the neck, wrist, ankle, or groin? Radial pulse. And I know I tell you this on every video. I'm so proud of you all. You all make me smile because you all are so smart. So if you chose B, wrist, you chose the correct response. The radial pulse is commonly assessed on the inner aspect of the wrist. And so when you're taking your nursing assistant exam for the state of Florida, you want to be mindful the radial pulse is beneath the thumb. You can feel a pulse sometimes at the base of the pinky, but that's not the radial pulse. So when you're taking the pulse for the state of Florida examination, you're going to have 2 or 3 fingers at the base of the thumb, and you're going to count that pulse for 1 full minute. So the radial pulse is here. The carotid pulse is in the groove of the neck off to the side. And again, you can use 2 or 3 fingers when you're taking a pulse. What you can't use is your thumb because your thumb has its own pulse. Number 5, how should a nursing assistant measure a patient's respiratory rate? Is it count the breaths for 10 seconds and multiply by 6, count the breaths for 30 seconds and multiply by 2, count the breaths for 1 full minute, or count the breaths for 15 seconds and multiply by 4? So Micheline, Karen, Myra, Emin, Louina, Latanya, Lynn, Sheena, Farah, Tabby. So many of you all, you have it correct. You're always going to count the respirations for 1 full minute. And respirations has different patterns. And without absorbing them for at least 60 seconds or 1 full minute, you're unlikely to obtain an accurate pattern. Critically ill patients may have apneic periods or periods where they stop breathing, and therefore counting the breaths for a short period of time may not give the accurate count. So watch the chest rise and fall for 1 full minute whenever you're counting the respirations. And then don't forget, you are not supposed to tell the patient you're counting their respirations. You're supposed to keep the element of surprise. So you can say something, a term such as, I'm here to take your vital signs, and you can hold the pulse and you can continue taking the pulse, or excuse me, holding the pulse as if you're taking it, but you're going to be counting the respirations instead. The reason why you want to keep the element of surprise is because if I know you're counting my breathing or my breaths, I'm not going to breathe. I'm going to control how I breathe. I may start holding my breaths. So keep the element of surprise. Say a term such as vital signs, especially if you're taking a Florida CNA exam with Prometric. The next one, everybody, question number 6. What is the normal range for adult respiratory rate? Is it 4 to 8 breaths per minute, 12 to 20, 24 to 28, or 30 to 35? What is the range for the adult respiratory rate? I've not seen a wrong answer yet. Yes, you all. The correct response for C is B. It is 12 to 20 breaths per minute. That's the normal range for an adult respiratory rate. When checking the respiratory rate, it's also important to note whether a person has any difficulty in breathing. So if a person is breathing 12 breaths per minute but is really shallow, that could be an indication that they're over sedated. So when it gets closer to that low range, you really want to be mindful, because if they fall asleep and their respiratory rate is 12, it can go lower. So you want to monitor that patient more closely, and of course notify your nurse if the rate of respirations does not increase. Number 7, which of the following readings are that of a patient with hypertension? So is it a blood pressure of 90 over 60, 130 over 85, 140 over 90, or 110 over 70? Hypertension. And this one's tricky. Yes, everybody. So it was not B. The correct response for this one is going to be C. So even though with B, the blood pressure was 130 over 85 and the diastolic was somewhat elevated, normally it's when the top numbers, the systolic is greater than 140 and the diastolic is greater than 80. So these two, we have two abnormal readings. We have the systolic and the diastolic. So this one is truly an abnormal blood pressure, which is representative of someone who's hypertensive. Number 8, what is the purpose of measuring vital signs regularly? Is it to keep the patients occupied, to identify changes in health status, to meet administrative requirements, or to increase the workload? Yep, your nurses just want to keep you busy doing stuff, so they have you do vital signs. So we know D is not the answer. Yes, a good CNA will save a nurse's job and a patient's life. So when you're taking those vital signs, it is to B, identify changes in the health status. Measuring the vital signs regularly helps to identify changes in the health status. So if their respiration rate decreases, if their pulse rate decreases or increases, all of that could mean that something is going wrong with your patient and you want to let your nurse know right away. Number 9, which method is commonly used to measure temperature in adults? Is it oral, axillary, rectal, or all of the above? And the word here is commonly. And don't think about the pandemic. Think of how we used to take temperatures before the pandemic. I see answers all across the board, so let me go ahead and help you. So, before the pandemic, everybody, we did oral temperatures. It was the most convenient and the easiest way to check a temperature. So, until the textbooks change, the oral temperature is still the most common and convenient way of measuring body temperatures. So, rectal is when we put the thermometer into someone's rectum or their bottom. That is not the most common way. That is pretty much critical care level. If you are taking a rectal temperature on a patient, that patient must be so cold, so sedated. They're probably also intubated. So we can't do an oral temperature. And because their body's so cold, we can't do a thermal temperature and we can't do an axillary temperature. So we're going to go in their rectum. And don't forget that whenever you're taking a rectal temperature, you don't stick the whole probe in their bottom. You only want to stick the very tip of the thermometer into their bottom in order to achieve in order to obtain your reading. And then oral, that's when the temperature is placed under the tongue. Axillary is when the temperature is placed under the armpit. So we'll normally do an axillary temperature is when maybe the person has on an oxygen mask or maybe they're a mouth breather. Right now, we can't use their mouth. So the next best place to go to would be the axillary temperature. That's not as accurate or as a rectal or an oral temperature. Tympanic we rarely use for an adults, but that's when the thermometer is placed in the ear. And temporal is what we've been using since the pandemic. Whenever they have the little scanner that they put towards your forehead, back in the day, we take the scanner from the forehead towards the temporal, and that's how we'd achieve our reading. But post-pandemic, the thermal or the temporal artery readings are the most common. But again, I don't know when the textbooks are going to catch up to current practice. So until your teachers tell you otherwise, you're still going to put down that the oral temperature is the most common temperature. All right, next question, team. I'm so proud of you. Number 10, what is the normal range for an adult heart rate at rest? Is it 40 to 60 beats per minute, 60 to 100 beats per minute, 100 up to 120 beats per minute, or 120 to 140? What do you think? When I tell you you are on it, and I know my patients are going to be in good hands with you all on the team, I'm so proud of you. Everyone chose the correct response, which is B as in boy. It is 60 to 100 beats per minute. That is the normal range for an adult heart rate at rest. 11. What is the purpose of measuring blood pressure? Is it to check the patient's weight, to assess respiratory function, to evaluate cardiovascular health, or to monitor dietary habits? And I love seeing some of my familiar names. Sometimes get to put a face with the name, but everybody, you are absolutely correct. So 2 thumbs up. Everybody chose C as in cat. It is to evaluate the cardiovascular health. So, measuring the blood pressure is done to evaluate the cardiovascular health. Blood pressure measures the force in the arteries as the heart pumps blood. It's recorded as two separate numbers, which we indicated earlier. The top number is called systolic number, and that's the heart, that's the pressure against the arteries as the heart pumps blood. And the second number, the diastolic number, is the pressure in the arteries when the heart relaxes, when it rests, and it allows the heart to refill with blood. And it's always measured in millimeters of mercury or mm over Hg. Number 12, which of the following may contribute to an elevated body temperature? Is it A, a urinary tract infection? Is it hypothermia, C, bradycardia, or D, hypotension? Yes, yes, team. So it wouldn't be B. B is tricky. Hypo means low. So hypothermia would not contribute to an elevated body temperature. Hypothermia would contribute to a lower body temperature. So the body temperature can changes if a person has an infection. So A is the correct response. So a urinary tract infection or any infection can cause the body's temperature to increase. Number 13, where is the normal range for an adult blood oxygen saturation level? Is it 60 to 80%, 80 to 90%, 94 to 100%, or 100% up to 120%? When we ask you to put the pulse oximeter on your patient in order to check their oxygen levels, what would be a range that you would be comfortable with? Yes, Jerlene. Yes, Ogal. Yes, Mayra, Luina, Augustine. Yes, Jean Baptiste. Yes, Rose. You all are correct. An adult oxygen rate, we like it above 94%. So an oxygen rate of 94 to 100% is normal for most adults. Oxygen therapy should be started when oxygen levels drop below 90%, even in a patient without symptoms. So I want you to also consider that not every patient is going to be normal. We're going to have some patients with chronic obstructive pulmonary disease where on their best day, they're satting 97%. So if they go down to 94%, no one's freaking out. But if they start dipping down to about 90%, of course, that nurse needs to be alerted so she can figure out what's going on with the patient, call the doctor, and we can get some additional orders. Maybe we can give supplemental oxygen. But because not every patient is going to be perfect, we're okay with an O2 sat of 94% as our baseline. Number 14, what is the recommended method of measuring blood pressure in most healthcare facilities? Is it A, papillary method? Is it B, oscillatory method? Is it C, oscillometric method? Or is it D, visual inspection method? Those are some big terms that mean small things. Do you palpate it? Do you auscultate it? Do you use something to look inside of it? Or do you just visually inspect it with your eyes? How do you check someone's blood pressure? And I see a toss up between A and B. And so there is a two-step method to where on the initial step you can feel for it. But whenever you start using a stethoscope, you auscultate, you listen. So the oscillatory method involves listening for sounds in the brachial artery. And I know many of you all have already downloaded our free Vital Signs Study Guide. But if you have not, you can go to fltraining.com, and on the first or the home page, it's going to say additional resources. The first tab there will take you to our free Vital Signs Study Guide. So in addition to having this video, you can review those numbers at home at your own pace. So if you haven't downloaded it, please go ahead and do so. Number 15, what can an irregular pulse indicate? Is it A, normal cardiac function, B, potential heart arrhythmia, C, low blood pressure, or D, elevated body temperature? Irregular pulse. So you go in and you check the person's pulse, and it is not beating at a normal pace. It's not beating like a drum. It's fast. What could that indicate? If you chose B, potential heart arrhythmia, you are correct. So, an irregular pulse can indicate that the heart is beating irregularly, or another term for saying arrhythmia. So, the heart doesn't have a steady rhythm, arrhythmia. And that could be because someone's in atrial fibrillation. It could be because their heart rate is really low, but that would be a reason that you would be contacting your nurse to come in. Number 16, which vital sign provides information about the force of blood against arterial walls? Is it the pulse rate, respiratory rate, blood pressure, or body temperature? And this should be super easy for you. I didn't expect anything yet. Yes, yes, yes. If you chose C, blood pressure, you're absolutely correct. So the blood pressure provides information about the force of the blood against the arterial walls. So again, systolic is when we're forcing the blood out the heart. That's the contraction. And then diastolic is when the heart rests. So we need those two numbers to determine if the heart is working harder than it should be. So when someone has hypertension, that means the heart has to work excessively in order to get the blood out of the heart and then to receive blood back into the heart. Number 17, when measuring a patient's axillary temperature, where should the thermometer be placed? Is it armpit, mouth, rectum, or ear? Revealing the answer in 3, 2, and yes, everybody. And so notice how I say it. I pronounce it as axillary. It is not auxiliary. Auxiliary is a cord. So an axillary temperature is the temperature taken in the armpit, and it's a way to measure the body temperature. And that is usually going to be the second route. So the most common route would be oral, but if a person has on their CPAP, their BiPAP, an oxygen mask, and or if they are intubated, we're not going to stick anything under their tongue. We're going to go for the axillary temperature instead. Number 18, what is tachycardia? Is it a slow heart rate, a normal heart rate, fast heart rate, or irregular heart rate? Sheena, Tamika, Tahira, Claudia, Myra, Alma, Rose, Karen, Latanya, Augustine. Oh, you all are going to be some great caregivers because you chose the correct response, which is C. Tachycardia refers to fast heart rate. And tachycardia in an adult is when the heart rate is greater than 100 beats per minute. However, don't be too concerned when you don't see your nurse freak out. because someone's heart rate could be 120 beats per minute and it's not due to their heart, it's due to anxiety, pain. It could be due to the fact that maybe their oxygen levels, they're not getting enough oxygen, and that alone can also cause the heart rate to elevate. So your job as a caregiver is to notify the nurse anytime something is abnormal, and then we will go in and do the additional, assessment. Usually tachycardia, in order for a nurse to be truly concerned, the heart rate is usually approaching 150. So anything less than that, maybe they have an infection, we're still concerned, but it's not a true cardiovascular emergency. We'll try to figure out the other outside influences that could be causing this person's heart rate to increase. Number 19, which vital sign is not always measured using numerical values? Is it blood pressure, pulse rate, respiratory rate, or pain assessment? Latanya says D. So does Karen and Tahira and Sheena. And looks like we have Myra, Ira. I think someone's named Blue. So you all are correct. So the pain assessment, how would you document someone's pain if they were nonverbal? We couldn't use numbers. We'd have to use cues such as grimaces. Maybe when you touch the person, their heart rate goes up. Or if it's a baby, maybe they're crying. If it's an adult and they're crying, but they can't tell you their pain level, we're going to automatically assume their pain level is above 8. So the pain assessment is not typically measured using numerical values because pain is subjective. CNAs must rely on input for residents in order to identify pain, but not all residents can verbally communicate. So if they're crying, that means that you're going to document that pain level being above an 8. If they're grimacing, that could be a 6 to an 8, but in either case, please try to notify your nurse because maybe she can give some medication like Tylenol to help decrease pain. Number 20, why is it important to measure and document vital signs accurately? Look, I know what you do. I know you feel about those respirations. You don't want to count the respirations. You document that everyone's respirations is 16, and that's not accurate. So why do we need for you to document someone's vital signs accurately? Yes, to ensure patient safety. And so this is an example that I want to tell you. When a patient has a pacemaker, even after death, so your patient could have died from some other causes. If you're only looking at the heart monitor is going to pick up the pacemaker. I need for you to go in and to check that patient's respiratory rate because your patient's respiration rate may be 0, but their heart rate may be 80 because it's picking up an electronic device. So when you all are doing your vital signs, I don't want you guessing. Really go in and check those patients. You should be checking those respirations. If you have to go and change your position every 2 hours, you should be checking their respirations every 2 hours. It's a quick fix because that way we can at least tell if there is a change. You may not have to document it, but at least assess it. You're in the room for one full minute, count their respirations. Sometimes those patients are not sleeping, you all. They've actually expired. Respirations are 0, but you're documenting that the patient is resting well because you never took the time to check to see if the chest was rising and falling. So the correct response for 20 is C. We accurately record their respirations or their vital signs to ensure patient safety. And here's just a synopsis of everything that we covered. The systolic blood pressure, the top number is 100 up to 140. The diastolic is 50 to 80. If your nursing instructor, if your school tells you anything differently, I need you to go by what they say so that you can pass their test. The adult heart rate or pulse is 60 to 100. The respiratory rate is 12 to 20. The temperature is 97.8 to 99.1. I know they say textbook temperature is 98.6, but most Americans are used to getting out of an air conditioned car and going into an air conditioned building. So our temperatures are rarely 98.6. And then what I did not include was the oxygen saturation. Oxygen saturations for adults should be 94% up to 100%. And if you can remember those vital signs, I know that you would be able to notify the nurse when something is outside of the normal values, and you would be able to help keep a patient safe. So, you know how we end each of our lessons. I want to thank you all for watching. I enjoy spending time with you all. You all really make my heart smile. And if you want to download the free Vital Signs Study Guide, you go to fltraining.com. And I'm going to come on here tomorrow with another video. I don't know what time, but I'll make sure I come on tomorrow. So everybody, I thank you, and I'll steer around for the chats. This again is Nurse Eunice with Florida Training Academy, and I'll see you in the next video. Miss Jerlene, hi.